some kind of condition that's making them make a lot of reverse T3 instead of making T3. And so if you give them T4 and they still have that tendency, if you haven't fixed whatever that is, they're just going to make more reverse T3. It's not going to make them feel better, and it might even make them feel worse.
Hi, skin friend. I'm so glad you tuned in to this week's episode of The Skin Reel. This week, we are going to be talking about your hormones, in particular, your thyroid hormone, because believe it or not, some of the skin conditions or hair loss you may be noticing or suffering from can actually be triggered by and caused by abnormalities with your thyroid. Now, your thyroid produces hormones that are so critical in many functions of our body. But a lot of times we don't recognize that that is what's going on because the symptoms can be kind of vague. You might be fatigued, you might be colder than usual, you might be gaining more weight than usual, or having some hair loss. And these can be kind of generic or vague symptoms, and you may not always recognize that it's actually your thyroid. And that is where experts like my next guest, Dr. Dana Gibbs, is here to shed some light onto the role of our thyroid and what to do when you are developing symptoms where it is not working correctly. Dr. Gibbs is a board-certified otolaryngologist. That's a fancy way to say an ENT or ear, nose, and throat doctor. She had spent decades removing people's thyroids. And then she realized, wait a minute, surgery wasn't always the answer. And so she went on and did some subspecialty training in allergy medicine. And she has now opened up her practice where she focuses exclusively on thyroid, metabolic, and hormone medicine in a direct care practice in Texas. I love how she breaks down hyperthyroid disease, treatments, and why, even if you have normal blood work, why you may still have problems with your thyroid. So if you are struggling with these sort of vague symptoms, maybe you've got some hair loss, maybe you've got some dry skin or eczema, you're definitely going to want to stay tuned to find out all about this important gland in our body, your thyroid. Dr. Gibbs, thank you so much for being here. I'm really excited about this episode because while it's not necessarily a skin issue, it kind of is, right? Because our body, all the organs are connected and our hormones and everything affect our skin. So I love that we get to hear your input as a board certified ENT and allergist. So thank you so much for being here.
Thank you for having me. This is going to be really fun.
I'd love to just hear your story because when people think ENT, right, ear, nose, and throat doctor, they don't necessarily associate that with maybe a hormone expert. So how did your career develop where now this is what you do primarily?
I'm an ENT, which stands for ear, nose, and throat, of course. And, what a lot of people don't realize is that ENT doctors operate on soft tissues in your neck as well, which includes the thyroid gland and all the tissues in your throat. And so I kind of came at the hormone part of it through the back door. I was trained to do thyroid surgery in my residency. And when I got out into private practice and, what I knew how to do for people was surgery. And I realized very quickly, not everybody needs surgery. Not everybody can be cured by having a surgery. And that was particularly the case with my patients who turned out to have allergy. They were, sinus disease or this or that. And sinus surgery is not always the appropriate thing. And so that was kind of the first aha as far as, okay, I need to learn how to do this, because I would send a patient who had, for example, just terrible chronic sinusitis. I would send them to the allergist and say, really, really convinced that you have a mold allergy. And they would come back with a prescription for some kind of pill. And I'm like, well, let me think. I could have done that. And what I know this person needs is allergy treatment, allergy shots or whatever. And so I went and did the fellowship training that is offered within ENT to learn how to be an allergist, how to do allergy testing, how to give people allergy shots, how to recognize, okay, you have a food allergy that's causing your nose symptoms. But it's not just that. I mean, food allergies cause hives and eczema and itching and all these things. And so I would see people's skin disorders and kind of over time got to this realization that your skin is kind of the gateway. It's kind of the window to your health. And if your skin is not healthy, then something is not necessarily just going on with your skin. Something is going on with your system that's kind of flagging us, hey, we need to look deeper. And so when I first started becoming aware that the way academic endocrinologists treat thyroid doesn't work for every single person, one of the first things that came up was, hey, you know what? What are the symptoms of hypothyroidism? Dry skin, hair loss, hives, itching. And I started noticing this in all kinds of people. They would walk through the door and I would look at their scalp through their hair and go, oh, well, you have a thyroid problem. And not every person who has hair loss has a thyroid problem, but so many more of them have that as an issue than even what the general endocrinologists recognize. And so that's kind of where that came from. It was a gradual, stepwise process that included my own personal health journey. I did not personally have skin diseases that came from thyroid, but I had thyroid problems that were not recognized by the mainstream. And when I figured that out, it was just like this light bulb explosion. And I started seeing it everywhere. You can't unsee it once you've seen it.
I love what you said about the skin being sort of a mirror reflection of what's going on internally. And I wholeheartedly agree. I mean, a lot of times as dermatologists, we're making these diagnoses for systemic things going on, diabetes, some genetic conditions. I just had a lady with Graves' disease who presented with hair loss, right? So I think sometimes we think of our skin as just being, for aesthetics and it's just our face. And we forget our skin has a ton of other roles. And a lot of times this is the outward expression of something being not right internally and that we do need to take a deeper dive. And yeah, even though I do a lot of surgery in ENT, that's a purely surgical field, right? But not everything needs to be cut out, right?
Right. Well, it's funny because you say ENT is a purely surgical field, but truthfully, when I went through residency, what I was taught as a philosophy was the medicine and surgery of the head and neck. And so, if you see somebody who comes in and they don't need surgery, it is your obligation to help them figure out what's wrong. And so I kind of took that to heart. And those people would come to me with their thyroid nodule or their skin condition or their weight gain or their whatever, as an aside from their sinus problems, because they don't come to me for that. But I would do a systems review. That's kind of something all doctors do. And when they would check all these boxes and I'm like, yeah, I think you need sinus surgery, but why don't we check your thyroid at the same time? And then 6 months later, they would come back and I'd be like, when are we going to do your sinus surgery? And they're like, oh, no, I don't need that. I just need a refill on that thyroid medicine. I'm like, what? That's when I knew I was really onto something because, thyroid is kind of at the basis of so much of your health. If your thyroid isn't working right, your immune system doesn't work right. Your cells don't grow right. Your energy level is terrible. You don't eat well because your energy level is terrible. You don't look good because you're not sleeping well. I mean, it just goes on and on. It just goes on and on. The puffiness around the eyes, there's just so much.
For listeners who aren't ENTs out there, which is probably most people, and a refresher for me, right? What is the thyroid gland? What is it?
So the thyroid gland is part of your endocrine system, and your endocrine glands secrete hormones into your bloodstream. And hormones are the chemical messengers in our body, and they basically regulate just about everything that goes on in our body that's not directly stimulated by some nerve, and some of them that are also stimulated by nerves. So your thyroid gland sits in the base of your neck, kind of behind the bumps of your collarbones, and it's shaped like a butterfly, or I like to tell people it's shaped like the Honda H symbol because it's got these lobes and it's got a cross part that goes over the front of your windpipe here in the middle. And it takes its directions from the other hormones that are produced in your brain and in your pituitary to activate your metabolism, basically. If you had to sum it up in 3 words, that's what it does. It activates your metabolism. But your metabolism is like everything. It's like your cell growth. It's like your hair growth. It's like your skin growth. It's like whether your GI tract works right, whether your immune system works right, whether you have energy or not, whether you can sleep well or not. There's just so much to it.
How do people usually come to you or present to you? Like, can you give us some examples? So I guess let's break it down between hypo and hyper, right? So low thyroid versus high thyroid, right? Because at least that's how I typically think of it, right? And then euthyroid or normal, right? But let's start with your favorite one, or which one do you see most commonly?
Well, I see mostly hypothyroid. That means low levels of thyroid. But here's the interesting thing is that you can have, on a basic test that most doctors would run, you can have normal looking levels of, for example, thyroid stimulating hormone, which is the most common test that doctors run looking for an abnormal thyroid condition. You can have normal blood levels and still have some more subtle dysfunction of the activation of thyroid hormone. So mostly who I'm seeing now these days are people who either already had thyroid surgery and had part of their thyroid removed, so then they have low function of their thyroid, or people who have an autoimmune condition called Hashimoto's disease, who have either been diagnosed or who sometimes haven't even been diagnosed. All they know is, I feel tired and crummy, and my doctor checked my TSH and said there's nothing wrong. Those are the patients that end up at my doorstep. And I also see people who have chronic pain. I see people who have gained weight and can't figure out how to get it to go back to where they were. I see people who have hot flashes and night sweats and then are freezing all the time. Those are some of the most common symptoms of thyroid that you think of is overweight and sluggish and tired and, sleeps 10 hours a day and still feels tired. But there's so many more things to it.
I could just throw in too, like some of the skin conditions that we would see is that the skin can be really dry. You can get cold often and the skin feels cold. You can have just super dry skin. You can get hair loss really with both hyper and hypothyroid. Your hair and your skin will be kind of lackluster, dull, not bright. And that's sort of a sign that I would be looking for as a dermatologist. Do you see similar stuff like that?
When I see a patient for the first time and they have some of these, because these complaints that I'm talking about, they're very vague. There's so many things that can cause them. But when they sit down in front of me and I look down at the top of their head and I can see their scalp through the hair that they have carefully combed back because they just have so little left right here on the top of their head, I'm like, I know what's wrong with you. And I confirm it, of course, with specific kind of blood tests that we can talk about. But that's kind of the first one. Some of the other stuff is hives. And I have seen over and over again people, and the reason they came to me is because I do allergy. But we got the allergy tests back, and no, you're not allergic to dairy, you're not allergic to wheat or eggs or all the things that you thought, but you have these unexplained hives and you have to take Zyrtec, for example, every single day of your life. I'm like, has anybody looked at why you have that?
Dr. Gibbs, you admitted that sometimes people TSH can be normal, yet they still can be hypothyroid. So are there other labs that you would recommend checking or have checked?
So I do something that is a little bit unique. There is a particular kind of test called the reverse T3 test. And in order to explain what reverse T3 is, it's necessary to go back and review what the other thyroid tests are, because TSH, thyroid stimulating hormone, doesn't come from your thyroid at all. It comes from your pituitary gland. And it's your pituitary gland basically signaling your thyroid to make more of the 2 kinds of thyroid hormone, which are thyroxine and liothyronine. So thyroxine is T4 That's the precursor. And then liothyronine is T3. That's the activated hormone that can be present some in your blood, but mostly right inside your body cells. And what we were taught in med school kind of stopped there. And it didn't say, hey, you know what? There's things outside of the thyroid gland that can inactivate your T3 or block your T3 or block the conversion of T4 to T3 so that you don't actually get the benefit of it. And that's the patient that I'm looking at, because most people who have had their TSH be abnormal and got put on thyroid medicine and they feel well, they don't end up in my office. They're boom, the mainstream, treatment fixed them and they're fine. But the ones that I see are the ones who they've read that list of symptoms and they know they have it. And they walk in my office and say, Doc, I know I have this. And I'm like, yeah, I'm looking at you and I can tell you have it too. And what I generally check is I check the free T3, and free T3 being that active form of the thyroid hormone that is somewhat present in your blood, but mostly what's present in your blood is T4 that has to be activated to T3. The normal range for free T3 is so big that you can be normal at a 3.5 on a T3, or you can be normal at half that much. And it's like, wait, a 1.9 or a 2 is not enough free T3 for you to feel normal. I think there's something seriously wrong with what the normal range is for T3. And so that's kind of the first simplest thing. But then the second is this reverse T3. And what reverse T3 is there are conditions in your body like Hashimoto's disease, like extreme stress, like extreme illnesses that make you activate your T4 to something called reverse T3. And reverse T3 looks almost exactly like T3, but instead of activating the receptors, it blocks the receptors. And so you can have normal looking T4, normal looking T3, and still not be getting the benefit of it if you have high reverse T3. And if you don't check that, then you never know.
You may have the T3, but if it's being blocked from being able to work and function, then you're still essentially hypothyroid.
That's exactly right.
And what is the treatment for hypothyroidism?
So mainstream treatment for hypothyroidism is to give people levothyroxine, which is the T4 that I was talking about. The problem with doing that for about 20% of people who are given thyroid treatment with T4 is that their defect was not enough T4 in the first place. Their defect was some kind of condition that's making them make a lot of reverse T3 instead of making T3. And so if you give them T4 and they still have that tendency, if you haven't fixed whatever that is, they're just going to make more reverse T3. It's not going to make them feel better, and it might even make them feel worse. So what I give them generally is the active form, the T3, which if you go to the pharmacy and get a prescription, it'll be called liothyronine.
Okay. And do you do that to everyone or only if they have high levels of reverse T3?
I do that depending on two things. One of them is if they have high levels of reverse T3 and their T4 is also high, then I will very slowly switch them from their levothyroxine that they're already on to gradually more and more T3 until their T4 number starts to drop down. So I actually want that T4 number, the free T4, to be at the low end of the normal range because I don't want them to make so much reverse T3. And then I also want to get their T3 number. I want to get it up into about the middle of the normal range. So a lot of people who treat thyroid problems kind of have an idea that they need to give people T3. And sometimes it's in the form of Armour Thyroid or one of these other treatments, but they don't know the thing about the reverse T3, or they don't know it well enough to really know what's going to happen when they do that. And so some of them will just give more and more and more of the liothyronine, and you can cause some pretty terrible side effects for people if you give them too much. So here's another thing. If you give it all at once a day, then the patient is going to be on a roller coaster ride because unlike T4, where the half-life is fairly long and it's pretty easy to manage, the half-life of T3 is pretty short. And so if you only give it once a day, then they're going to be really high for about an hour after you give them. And then they're going to be really low, and then they're going to be high and then low. And so this will manifest as irritability and then fatigue, and then irritability and then fatigue. And some of them will even get side effects like rapid heartbeat, which are dangerous, frankly. And so you don't want to go high. You don't want to go to where the person is higher than that normal range. And I see that being made as a mistake in a lot of other practitioners who treat thyroid.
Do you tend to dose it twice a day, 3 times a day? What do you recommend then?
It kind of depends on the patient. So most patients who I treat are on a twice a day regimen, and they take it first thing in the morning, and then they, generally will start to feel like they're flagging a little bit in the middle of the afternoon. And so we'll kind of pick their afternoon dose timing based on when they start to feel tired again. Some people are willing to take 3 times a day. And in those people, I think it works better if they take it 3 times a day. Ideally, your body secretes T3 a little bit every minute all the time. So if I could break that pill into 24 parts and have you take 1 every hour, that would be my favorite.
Yeah, I think compliance might be low.
Yes, a little bit of an issue there. And if there was actually a sustained release product that worked, I would be all for it. But what I found with sustained release compounded products is that basically what happens is the patient's just getting a lower dose, and you do their test and their tests are low. And I'm like, well, this isn't working. So we need to actually do something different.
And are these medications things that people have to be on for the rest of their life, or is this something that corrects itself?
It depends on the reason that they need it in the first place. So somebody, for example, with Hashimoto's disease, if they're already pretty far along and their thyroid gland has been damaged quite a lot, then they may not be able to recover and get back the function of their thyroid gland to an adequate degree. But there are a lot of other reasons why this can happen. And high stress is one of them. So if you go around with your cortisol levels, way up here all the time, then one of the things that happens is that it knocks down your thyroid function in the way of making reverse T3, but it also pushes down your TSH because it's telling you, look, you need to slow down. You're stressing yourself out. You're going to have a heart attack, whatever. Your body is smart. And the modern lifestyle that we sustain with this, sleeping 6 hours or less or getting up at 4 a.m. to go work out, if people are not doing things that are healthy for their body with their diet and their lifestyle, it's going to come back and bite them. And those kind of things affect your thyroid in negative ways.
Yeah, you may be able to fake it for a little bit, but it'll catch up with you eventually.
It'll eventually catch up with you.
How do you know that, Dr. Gibbs?
If you have a lot of folks who are familiar with medical training on, who are your listeners, they will realize that medical training is extremely brutal as far as sleep loss and as far as the amount of stress and the high expectations. And my stress was off the scale. Really off the scale. And, when I went into the medical clinic at my residency and told them that I was freezing all the time, that I was sick literally every month, that I couldn't keep up, that, this and that, they were like, oh, you're fine. You're having these antidepressants. Well, the first time I took thyroid medicine, and, I did it at the recommendation of a friend of mine who knows all this stuff too. The first time I took thyroid medicine, it was like, holy moly, I feel like a completely different human being. And this was not depression. This was, wow, I have the energy to get up in the morning without an alarm. I don't need an entire pot of coffee every day to get through the day. I don't lay in bed and shiver for an hour before I fall asleep because I'm so cold all the time. There were so many things that changed for me when I started on thyroid. And I went literally 20 years not knowing that that's what it was.
Anyone listening having symptoms like that to get checked, to see someone and then to maybe probe further if your blood work on first glance appears normal, right? To really dig deeper and advocate for yourself to do those extra tests.
And I will say a little bit about that because I was not diagnosed or even taken seriously by endocrinologists. The way most endocrinologists, particularly in the academic world, which is where I was at the time, of course, they are strictly by the book, mainstream. They're not looking for these outliers. They're not looking for, oh, Hashimoto's disease, come to me, come back when your TSH is above 10. And, if your stress level is really high, your TSH might not get above 10 until you've had it for 20 years. So the kind of doctors that tend to know more about this stuff tend to be the integrative medicine specialists who have, at least heard about what I'm talking about. And you can ask, does your practice prescribe liothyronine? And if they say, well, no, then don't even make an appointment because they're not up to date on the research. They're not up to date on what's going on. And I hate to say that, but I think in medicine as a whole, we are very, very hesitant to try new things. First, do no harm is kind of the thing. But every now and then, I think we harm people by not being innovative.
Right. And being kind of stuck in the past in some ways. Well, let's kind of flip the coin. Let's talk about hyperthyroidism. So I just had a lady with Graves' disease going through this. Tell us more about hyperthyroidism. So that's going to be when your thyroid levels are high.
So there are a couple of reasons why people will get hyperthyroid. One of them would be that you have a tumor in your thyroid gland that's either benign or not benign that is producing thyroid hormone independent of the control system, which is the TSH that we were talking about earlier. And then the second reason is a different kind of autoimmune disease besides Hashimoto's. It's the antibodies, because that's what autoimmune diseases are. They're your body attacking body tissue. So the antibodies that are made against your thyroid actually bind to the receptor for TSH and stimulate them, which makes your body make excess thyroid hormone, like way excess thyroid hormone at times.
Like flips the switch to constant on, huh?
To always on. And people, the typical symptoms would be, oh, wow, I can eat anything I want and I don't lose weight. People with Graves' disease can eat constantly and not gain weight because their metabolism is revved up so fast. Their heart rate will be fast to the point where they're like, I'm having panic attacks. And I'm like, no, you have too much thyroid hormone. Your heart rate can be very, very high. You can be having palpitations. A lot of people will describe irritability, I'm angry for no reason that I can tell. Anxiety, people will say, oh, I'm having panic attacks. If it goes on long enough, they will start depositing there's special kinds of sugars called glycosaminoglycans inside their eye sockets around the muscles of their eyes, which will make their eyes actually start to be too open. Like, I don't know if you guys remember what Barbara Bush looks like, but her eyes, you could always see a little bit of white over the top of the dark part of her eye. That's called lid lag. And that's a kind of a characteristic of Graves' disease antibodies. And then the other thing is where the eye sockets actually start to swell and push your eyeballs forward. And it's really kind of disfiguring and very uncomfortable. And there are actually now new kinds of drugs that can actually stop that, which I'm so happy that there are now drugs for that, because you can take the person's thyroid gland out and it reduces the target for the antibodies, but they don't completely stop. And so that's one of the things that even if you've taken somebody's thyroid completely out and they can't make any thyroid hormone, then one, I'm treating them because now they need thyroid hormone, but two, they're still having this awful eye problem. And as their thyroid is going up and down, the levels of their thyroid hormone are going up and down, it can cause them to first be sweating all the time, and then they can suddenly lose a big hunk of their hair, and then as you get the levels back down, maybe it'll grow back, or maybe you used the suppressing medicine a little too much and even more fell out. It can be a very frustrating condition to try to treat for people.
In dermatology, we'll see the hair loss is a big component, and then that you can get this sort of doughiness to the skin, especially the shins, what we call pretibia myxedema. And so that skin will be really puffy and swollen. And that's another key sign that sometimes we'll see first before the patient has even thought to go seek or even thought that maybe there might be something going on with their thyroid.
And that puffiness, it's called glycosaminoglycans, and they have what's called high hyaluronic acid. And you dermatologists know that very, very well, because we use it on purpose to fill in deep, deep lines and wrinkles.
Yeah. And to pull in water and hydrate. Yeah.
Yeah. It hydrates your skin. It pulls a bunch of water, like 10 times its weight in water. And you don't want that under your eyes where it makes them bags. It makes eye bags. You don't want it out here where it just makes you look tired. You don't want it around your wrists, and you don't want it behind your eyeballs, and you don't want it on your shins either, but that's where it goes.
Yeah. And sometimes those are sort of the first signs that someone will have that make them seek help. Or if we see them, we're like, wait a minute, we got to check your thyroid here. So same sort of blood work that you would do with working up hypothyroid, get the TSH, T3, T4, what do you recommend here?
So I have my Fab 5 that I always do, which is the TSH, free T3, free T4, the total T3, and the reverse T3. But anytime there's any question at all, or if somebody has symptoms that I think are related to thyroid and they haven't had those tests done, is that I will do antibody tests, because you can find 90% plus of autoimmune thyroid disease with antibody tests. And for the hyperthyroid person, I will do the thyroid stimulating immunoglobulin, which is the one for Graves' disease. But I will also do the thyroid peroxidase antibody and the thyroid globulin antibody, because sometimes people have all three. And it's like, oh, wow, okay. And if I see somebody who I think has Hashimoto's and they have ever had a period of time where they were having the palpitations and all of that, I will do that thyroid stimulating immunoglobulin as well, because you don't want to miss somebody with Graves' disease when you go start giving them T3 and all of a sudden they're just like, oh my gosh, I can't sleep at night. What's going on?
What is the treatment then for Graves' disease or hyperthyroidism?
So generally, anything that you can do that calms down inflammation in your body is a really smart thing to do. It's kind of the hallmark of integrative health. It's gentle exercise like yoga. It's diet modifications. Try to remove anything you might be allergic to food-wise and do some experimentation to see what's going on there. It's getting plenty of sleep and making sure that you're managing your stress through, sleep management, meditation, the like. So those are kind of the baseline. That's what kind of everybody has to do. But then to take down the symptoms, if you got somebody that's heart rate is 115, 120, then they need to go on sometimes a blood pressure medicine. There's a certain kind of blood pressure medicine that we use to slow your heart rate down, and some people need to go on that. And then there are medications that suppress your thyroid's ability to make thyroid hormone. And so that's another, methimazole is the name of one of those. And then there's another one called PTU, which we use for people who don't tolerate methimazole. And if you do that for a while and you can't get it balanced out right, and they're still having trouble, then a very common treatment these days is to do radioactive iodine treatment, where they basically have you swallow iodine, goes straight to your thyroid gland and basically kills off the thyroid tissue, which I don't love. And I really try to help people through so that they don't have to do that, because there's side effects. I mean, there's side effects to everything, right? But there's a lot of side effects to having had radioactive iodine, including the killing off of your parathyroid glands that help you keep the body calcium in. So if we can not do that, I would love to not do that. And so I do make every effort before I send somebody and say, you know what, I really do think you're gonna have your thyroid removed because this is dangerous. It's gonna lead to heart failure, and that's really a bad situation.
Gosh, well, I have had such a great refresher and learned many new things about the thyroid. So it's been a bit since I've been in medical school, but can you share with the listeners what are kind of your top 3 tips for someone for having a healthy thyroid, and then maybe what they should do if they think they don't have one?
The first tip is to be very, very careful about vitamins and minerals. And I do think that everybody probably ought to be on a good multivitamin with multiminerals, because there are 2 minerals that you absolutely have to have a healthy thyroid. And those are selenium and iodine. And iodine and selenium are both very, very tight in the ranges that are okay, because you can injure your thyroid gland by taking too much of either one of those. And you can actually injure yourself. I mean, high doses of selenium will cause birth defects. It can be quite dangerous. High doses of iodine, and I see this all the time, high doses of iodine can trigger somebody to go into autoimmune thyroid disease. And so you want enough, but not too much. And the best way to get that would be to go and find a really good high quality trace mineral supplement that has, the RDA is a little bit low, but maybe twice the RDA, but not 15 times the RDA. That's not recommended.
Sometimes people get so excited to take a vitamin, or they hear it's good for you and they're like, I'm going to take 5 times. Yeah, so don't overdo it. Don't go nuts.
Be very, very careful about thyroid support supplements that can actually have non-FDA approved levels of thyroid hormone in them. So I see that every now and then, that somebody's on a thyroid support supplement and their levels will just be all over the place. And I'm like, what is going on here? And I'll have to say, okay, you're going to have to stop taking this for 2-3 weeks, and then we'll check again and see what's actually going on, because that's a biggie. Food-wise, there are a lot of people who really advocate for a gluten-free diet with regards to thyroid health. I am not super convinced that gluten-free is the answer, but I am very much in concordance with a lot of the lifestyle medicine doctors that we as a society eat way too much sugar, we eat way too many processed carbs, we eat way too many pro-inflammatory fats, we're exposed to way too many toxins, and even in beauty products, so many toxins. And I could go on all day about that, and I'm not actually the world's #1 expert on what's toxic and what isn't toxic. I just know that more of an unprocessed whole food, even, I like the word paleo. If you go into the grocery store, you can find these packages of what's called paleo cookies. And I'm like, it's processed, it's in a package, therefore it ain't paleo. So the idea of paleo is great, but the food manufacturing companies are going to find a way to hoodwink people no matter what we do. I think if you have a family history of autoimmune disease, be very, very cognizant that Hashimoto's particularly, but thyroid autoimmune disease is generally the gateway autoimmune disease that people come up with first. If they don't get, for example, like type 1 diabetes as a child, that's another thing that I don't think we realized for a long, long time. When I was in med school, we didn't know type 1 diabetes was an autoimmune disease.
Well, gosh, and yeah, anyone listening who is having symptoms, maybe very cold all the time, super dry skin, hair falling out, fatigued, or the opposite, right? Tons of energy, can't fall asleep because they're wired, eating all the time, not gaining weight, and maybe getting that sort of doughiness to their skin on their shins or around their eyes, seek help, seek someone. If you're not getting relief with the treatments, then dig deeper and maybe seek someone with more integrative or more of a holistic approach who might be able to kind of think outside the box, do these extra tests, and help you work through it and make sure if it is a thyroid disease, what the next best steps are.
Yeah, absolutely perfect advice.
Well, Dr. Gibbs, this has been a lot of fun. Where can our listeners find you if they want to see you as a patient or follow you and hear more about what you're doing and the world of thyroid and hormone medicine?
So my website is www.danagibbsmd.com. It's pretty simple. On all the socials as Dana Gibbs MD. And I see patients virtually or in person right now in the state of Texas and also in Iowa. And if you don't have somebody local to you, reach out to me anyway. My contact information's on the website, and I can probably help you find somebody local.
Oh, wonderful. Well, we will link all of that in the show notes so people can easily find it and click it. And I really appreciate, Dr. Gibbs, you spending the time and helping educate us on how some of these skin conditions really may be more of a thyroid issue and something else going on internally. So thank you so much.
You're so welcome, and I've enjoyed it very much.
We'll see everyone next week.